Hi, I'm Eric Buxbaum with Advanced Orthopedics and Sports Medicine Institute. I'm an orthopedic surgeon with fellowship training in adult reconstruction, focusing on hip and knee arthroplasty. I specialize in treating degenerative conditions of the hip and knee, including primary, minimally invasive knee replacement surgery, direct anterior hip replacement surgery, as well as revision hip and knee surgery. I also specialize in general orthopedic care and fracture care, as well as advanced periprosthetic fracture care for those patients who have fractures around previously placed orthopedic implants, especially hip and knee replacement parts. I grew up in Staten Island, New York, where I got my first taste of medicine while shadowing an orthopedic surgeon when I was in high school. I spent my high school years attending Cottonville High School before moving on to college at SUNY Binghamton in upstate New York. That then led me to medical school, where I went to Toro College of Osteopathic Medicine in Harlem before beginning my internship and residency at the Inspira Health Network located in Vineland, New Jersey. My residency in orthopedics included multiple rotations at other sites in the South Jersey and Philadelphia area, including Christiana Hospital in Delaware, Cooper University Hospital, St. Christopher's Children's Hospital, and the Atlanticare Health System. I then went on to my fellowship training in adult reconstruction with the Rothman Institute in South Jersey before beginning as a practicing orthopedic surgeon at Advanced Orthopedics and Sports Medicine here in Freehold and Monroe. Every patient is different, and no two hips or no two knees are alike, so I really try to individualize treatment for each patient. We have a list of conservative treatments that we can offer patients before going to surgery, and I take into account patients' function, age, health, and other factors when we make these treatment decisions. If the decision is to proceed with surgery, I do review all the risks, the benefits, the expected recovery, and everything else to give the patients the most information they can have so that they feel well educated on the procedure that they will be going forward with. One common misconception that I see about joint replacement surgery is that patients come in thinking that they can't get back to the activities that they enjoy. That's just simply not true. I have plenty of patients who return to running, some even playing basketball and tennis after hip and knee replacements. My goal is to get you back to doing all the activities that you want to be doing, and with hip and knee replacement surgery, that is possible. I take it as a privilege to get to take care of other people's health. I realize it can be a nerve-wracking experience to see a doctor that you've never met before and have them tell you treatment options that could potentially even include surgery. So ideally, I like to make every patient feel as comfortable as possible when I'm talking to them. I think it's really important to educate patients and make them fully understanding of what they're going through and the available options they have. I really try to individualize treatment based on patients' feelings, health conditions, age, function, and other factors. I think taking all these factors into account is really important in providing each patient the best treatment that we can. And when it comes to surgery, I really feel education is most important. I try to explain all the risks, benefits, early recovery expectations, and long-term outcomes that patients can look for so they really feel like they understand what they're getting into.